Now let's get into what your body does to prepare for labor. Number one, relaxin hormone. And you're going to learn more about this later in the course. But relaxin hormone is a very, very important hormone, and it does exactly what it sounds like. It relaxes. So it relaxes your body. It relaxes the joints, the muscles, your hips, bone, pelvic, right? And it relaxes your body so it will be easier for your body to open up when it's time for you to deliver your baby. Now, we want that hormone relaxing. We want that hormone, but it can be very uncomfortable. So when you're in your third trimester and you see a woman really walk like this, it's because of relaxin hormone. Because it's just freaking uncomfortable, right? To walk the way you really want to walk. And also, you have to like swing around yourself because your pelvic, your hip is just so loose compared to when you hit your second trimester, or when you were pregnant in your first trimester, or before you became pregnant at all, right? Everything is just a lot looser. Not only that, it seems like it's harder to just be able to stand on your 2 feet by yourself. More mothers become more clumsy in the third trimester because of how loose everything feels. And the bad part about this, when everything feels a lot looser and you need your hips to support you, right? It's just, there's a lot of pain. And when I say pain, I mean more of like a mild ache. Some women, depending on how many babies they have had, they're like, no, I'm not experiencing mild aching back. I'm experiencing pain, and my back hurts, my hips hurt, my pelvic hurt, right? So this is the time to get a support belt that you will wrap around your pelvic and your stomach, pregnancy belt, and just lift up your belly. Oh my goodness, and it feels so good. Lift it up to just put pressure off of your lower body, to just give you some support. Support your lower body to support your upper body. And if you just need to lay down and rest, okay? So that's one thing that happens, the relaxin hormone. Another thing that happens is in the third trimester, the membrane between the placenta and like mom and baby, that membrane that protects the baby, it doesn't allow certain particles to come through the placenta to travel to the baby. Is very protective. That membrane actually opens up near the end of the trimester. Not all the way, but it gets a lot bigger to allow certain things to come through, certain antibodies to come through, so your baby can be prepared when it comes to earth. When it comes to earth. But your body is really smart, and let's protect the baby, keep the membrane as close as possible to allow certain particles to come through. But during the last trimester, it's like, okay, the baby's going to be born. We need to get any antibodies that mom has. So that's why your doctor may push for certain vaccines, because they know that if that vaccine is in your bloodstream, it can pass to the baby, and your baby can get the antibodies for that. But that also should make you think about whatever drug that you do get, because the membrane is more open, right? It's a higher possibility or higher chance for your baby to also get whatever drug you receive during labor, or if you are doing anything outside of that, like wine or cigarettes, things like that. Just remember, in the third trimester, your membrane is a lot more open, and it allows things to actually pass through. So just think about that and keep that on your mind if you are thinking about having a medicated birth. Ask about the risk and decide what's best for you and your baby. So another thing that happens. So this is more towards the baby. Your baby actually starts building up iron in its body, which is really important. Your baby actually builds up enough iron in his body that when it's born, it has all the iron it needs for the first 4 to 6 months of its life. And that's why it's really important to make sure that when you deliver your baby, you actually wait to cut the umbilical cord so your baby can receive everything, all the blood that it's theirs from the umbilical cord, from the placenta to the umbilical cord to the baby. Okay, so when your baby gets all of its blood, it's receiving all of the iron, and your baby will be prepared for life, and it will have the amount of iron it needs for its body for the first 4 to 6 months of its life. And that's why when babies are fed formula, or they have iron supplements, it may cause them to be even more constipated. Iron makes people constipated, okay? But if you already have enough iron in your body and now you're taking in more iron, it really may cause you to be more constipated. And so just remember that and think about that, but always do what's best for your baby. If there's some issues and your baby, for example, my baby was preemie, and we needed to make sure that he was getting iron after he was born, because obviously he came early. So if you have a term baby, just remember, don't feel so scared about, oh my goodness, I wasn't able to give my baby their iron supplement. Just remember that your baby has the iron it needs for the first 4 to 6 months of its life. So the next thing, or one of the things that happens, is your body experiences cervical changes. And come on now, how many times you hear women talk about the cervix during labor? Or, not even during labor, before labor, during pregnancy, third trimester, 37 weeks, 39, right? So I'm going to put some stars next to it. Imagine fireworks around it, because women get really excited about cervical changes, any discharge, bloody show, if you're dilated, right? If you're 1 centimeter, 5 centimeters, 10, we really get excited because we think about, oh my goodness, does this mean I'm going into labor, or is my labor almost finished, right? So we are going to talk about cervical changes. And the cervix is very, very interesting. Even before you're pregnant, your body goes through changes. Like your cervix goes through changes all the time. So I am going to draw the vaginal canal and the cervix, and it's like we're looking through the vaginal canal up to the cervix, and it's not to scale, so bear with me. The cervix is going to be, not the cervix, the vaginal canal, it's red. So here's the vaginal canal, people. And our beautiful cervix. It looks like a donut, believe it or not. So, and that little space right here, you see that? That little space right there is opening into the uterus. So when you are not ovulating, your cervix becomes real thick. And it produces a thick mucus that that looks like a brick wall in your vagina. Okay? Yes. This cervix means business. It's like no sperm coming through today. All right. So my purple marker represents sperm. So when you're not ovulating, your body is tough. Your body's like, there's no need really for like sex. There's no need for sperm. So cervix close up, get thicker, and produce this thick mucus. And so when the man has the orgasm, the sperm really can't travel. It gets stuck. It can't really travel up to the cervix and to the uterus, right? Because the body doesn't want it to. But when we are ovulating, right? You're going to see the difference. When we are ovulating. Ooh, look at that. Your beautiful cervix becomes thinner and it slightly opens up. And your cervix, the position. So when we are not ovulating, your cervix is turned or pointed towards your bottom. When we are ovulating, it is more forward. And it produces a mucus that helps the sperm thrive, okay? So, as we know, the vaginal canal is very toxic for the sperm, but the cervix knows we are ovulating and we want the sperm to survive. So it produces produces a mucus that creates like channels, or like it becomes a highway. And in the highway, right, is the perfect temperature, the perfect environment for sperm to actually thrive and survive, so it can travel and make it up to the cervix and to the uterus. So now all the millions of sperm that is ejaculated into you, right? They have a way to get up to the cervix, into the uterus, and to find hopefully the fallopian tube. And in the fallopian tube, that's where the sperm can live up to 5 days and wait for the cervix to, not the cervix, the egg to be released. So that's just amazing. So that's what happens to your cervix when you're not pregnant, okay? So when you are pregnant and you are getting closer to labors, right? Your cervix, the position of your cervix actually becomes in the center, like it gets in the center. It's not pointing towards towards your bottom. It's not forward. It's in the center, and that's what happens when you get closer to labor. When you're actually in labor, there are certain things that happen. Your cervix moves forward or points forward. It actually begins to soften. It thins, which we want that. We want our cervix to thin. And when it thins, it dilates. And we want that to happen. I know so many mothers worry about dilation, but we need effacement to happen first. So you want your cervix to shorten, right? And you want your cervix to get soft, thin out, right? And because it's usually, let me draw this out. It's usually thick, okay? And you want it to thin. Let me draw this a little better. You want it to thin out. There you go. You want it to thin out. So when it thins out, it can actually dilate. So let me keep the circle the same. So you want it to dilate. There you go. And that's why you can hear sometimes mothers experience, oh, I went to the doctor. They say my cervix is soft and thin, but I'm only 1 centimeter. Well, oh my gosh, that's wonderful. Because now that you're soft and thin, you can actually dilate. So that's some of the things that happen before you go into labor. Save the best for last. And the best is Braxton Hicks and prodromal labor. Now, this can become very confusing to mothers when they're experiencing contractions. They're trying to figure out they're experiencing Braxton Hicks, prodromal labor, or actual true labor. So hopefully this will help you understand. So when you're in the third trimester, it's very normal to experience contractions, right? You're getting closer to your due date. You're getting closer to delivering your baby. So therefore, you're going to experience more contractions. The first contraction we're going to talk about is Braxton Hicks. Braxton Hicks is like the practice contractions. You feel it mostly in the front. Your cervix does not change at all when you are experiencing Braxton Hicks. And there are certain things that you can do to stop Braxton Hicks. One is drink more water. Drink more water because when you're hydrated, your body actually starts having more Braxton Hicks. So just remember that because you don't want to stay dehydrated and then go into preterm labor or anything like that. So your body is basically telling you, please drink some water. Okay? So drink water. Another thing you can do to stop Braxton Hicks is go to the bathroom. So when you have a full bladder or you need to poop as well, you may experience Braxton Hicks. And after you relieve yourself, your Braxton Hicks are no longer happening. And that's very, very normal. Another thing you can do is relax. Go into the shower or a tub or whatever you do. Lay down. That will also stop your Braxton Hicks. Another thing that happens when you experience Braxton Hicks is when you are having that contraction and you're sitting down and you decide to move to a different position, your Braxton Hicks will stop. And it's because it's only practice contractions. It's not real contractions. Braxton Hicks are not really intense and it's really unpredictable. It's not very, very consistent. You're not going to see Braxton Hicks every 10 minutes, right? It's not like that. It's just really the baby, the first step to actual contractions. So it's practice contractions. So the next level, right? That's the first level. The next level, the next step is prodromal labor. Now, one thing prodromal labor has with Braxton Hicks is if you're in one position and you're experiencing contractions and you move to another position, it will stop. Or if you are not having a contraction and you're sitting down and you decide to move, it could start. Right? So that's one thing prodromal and Braxton Hicks have in common. But other than that, they don't have anything else in common. Prodromal labor cannot be stopped by using the restroom, drinking water, taking a shower, taking a bath, laying down. It will not be stopped by those things. Prodromal labor actually can change your cervix. It can make your cervix more soft. It can actually thin your cervix, and it may also dilate. But it's a very, very, very slow process, and it takes a long time. Prodromal labor does not break your water. at all, because these contractions are real contractions, but they're not as intense as true contractions. Okay, so it will never lead to actual delivery. So if you're only experiencing prodromal labor, you're not going to go to 10 centimeters. Only when you experience true labor will you experience early active transition, pushing, delivery of your baby. Okay. Another thing, prodromal labor does not get more intense. So it may be consistent with contractions, but it doesn't get more intense. So with true labor, you will experience intensity. So it may start off where it seems like, okay, contractions are farther apart. They're easy to manage at the moment. But in true labor, contractions get closer, and the intensity of your contraction gets a lot harder to manage without certain coping mechanisms or comfort techniques, okay? Or some women use medication. So prodromal labor stays consistent and it doesn't get intense. I've experienced prodromal labor and it could be tiring. I know, like, for the first week before I actually went into labor, I was experiencing prodromal labor from 8 p.m. to 1 in the morning every night. I was having contractions, consistent contractions, every 15 minutes. And it was intense, but not as intense as true contractions, but it could be very tiring if I'm having contractions like that every 15 minutes, that long. And I was hydrated, and I was taking showers. I was doing everything. Maybe this is Braxton Hicks, and it wasn't. It was prodromal labor. So that's the difference between Braxton Hicks and prodromal labor. Okay? So this is some of the things your body does to prepare. It releases the hormone relaxin. It opens up the membrane between mama and baby so the baby can get the antibodies, right? So relaxes the muscles, the joints, the pelvic, gives the baby all it needs, antibodies. The baby has all the iron it needs when it's born, if it's term baby, for up to 4 to 6 months of its life. There's so many things happening with your cervix. Your body has more contractions. It will experience Braxton Hicks, but there are things to do to change Braxton Hicks, or not change, but actually stop Braxton Hicks. Drink a lot of water. And then you may experience prodromal labor, and do not be discouraged if you are having intense, if it feels intense. Always, please check in with your provider at any time you feel uncomfortable. But prodromal labor is just another thing your body does to prepare for actual labor. So let's talk about the signs of labor. Woo!